3 decades ago, MedFlight transported its first patient. We ride along to see the progress this ambulance in the sky has made over the years.
Working for you in the spirit of Arkansas, this is Channel 7 News Nightside.
Well, it was 30 years ago when it first took off. In May of 1984, the MedFlight helicopter team changed the way Arkansas looked at medical response times forever. And since then, they've had 3 different helicopters, covered greater area across the state, and saved countless lives. Jordan Bonnke got to spend a day with the team and gives us an inside look tonight at how MedFlight works.
Well, this is a very big year for MedFlight. On May 4th, 1984, they were ready to start taking patients, but it wasn't until 2 days later when they flew their first trauma victim back to the ER at Baptist Health. A lot has changed since then. They have a new chopper, their own floor at the ER, and enough staff to not have to work 24 hours a day anymore. I got a good sense that it was a pretty good job because some of the staff is still there 30 years later, still with them today. And with the experience like that, when they got called out, it was like muscle memory to them. Take a look. Just seconds after hearing this,
MedFlight crew launch for.
The MedFlight crew is off to save a life. In the month of April, this $1.2 million helicopter left and brought back patients over 20 times.
We always hope for that tailwind coming back.
Brad Childress is one of the pilots for MedFlight. When this patient was having heart trouble in Carlisle, it was Brad and the MedFlight team that intercepted him and brought him back to Baptist Health, turning a 40-minute drive into a 15-minute flight.
We don't have traffic issues to follow. That's an asset that we can provide.
Pat Hum has been with the Baptist Health's MedFlight team since it all started. He says that back in May of '84, the hospital used to fly a borrowed Huey helicopter from the Air Force Base. Now, aside from surgery, everything they can do in the ER, they can do in this small space of the helicopter.
It's not the helicopter, it's the people you work with and the people providing the care and the pilots, mechanics. It's the people who make the MedFlights, not that helicopter.
So Pat and his team let me on board for an exercise they were doing with the Air Force Base. Once the call came into dispatch,
Probably MedFlight on final 0954.
we were 1,500 feet in the air looking down over the Arkansas River. The drill called for MedFlight to retrieve a victim who had fallen off a building. Once we landed, MedFlight administered an IV to the patient, moved him onto the stretcher, then buckled him into the bird. Inside the cockpit, there isn't much room. The patient lays on the floor just under the seat of the flight nurse. From takeoff to picking up the patient, the operation took just under 20 minutes.
So it gives an opportunity for us to see where our resources could be bettered or the things that we lack in our service so that we can improve them for later.
So what keeps this small team of pilots and flight nurses going?
It's a team effort that makes us up. The helicopters is our speed. It's our transportation.
It's nice to feel like we're a little bit of a link to something that can, possibly have a good outcome for them.
When time is a major factor in life or death, it's this team and their chopper that give them the best possible advantage. Well, imagine having an office view that is 1,500 feet in the air. Very cool, a lot of fun that day. I was told by the MedFlight team just to take the helicopter off the ground, it costs $5,500. And once the patient is in the chopper, it's $83 an hour. The flight that I was on was just 15 minutes. So what's the quick math? That's over $6,700. But depending on insurance, you can cover up to 80% of that bill. Beth, Scott.
Yeah, well worth the cost, though, to save lives.
Absolutely.
Jordan, thanks very much.